Hello, everyone. This is Braswell Dean from the Department of Family Medicine here at Providence Hospital. So, this is part 2 of our Codeology series. Today, we're looking at the coding game for review. Last time, we talked about an introduction to E&M coding, and we talked about the 3 parts of the code for E&M coding, which is the complexity of medical decision-making, the history, and the physical. And we also spent some time talking about documentation. So now we're going to jump right in and look at some of the components of complexity of medical decision-making. Specifically, we're going to look at risk, data, and diagnostic management decisions. If you have that little worksheet that we were using last time, make sure you have it in front of you if you can. I think it will be really helpful because all of these rules and all of these sample cases not only are written in your language so you can understand them as a doctor, but they're also written to be consistent with learning on this learning tool. So let's jump right in. So our objective today is to try to have fun learning these basic rules of coding. Again, the risk, the data, and the diagnostic management decisions are going to all help determine the complexity of medical decision making. And again, as we said last time, to be really, really ethical, we're teaching that let the complexity of medical decision making, otherwise MDM or CMDM, let that drive the code. Let that drive your decision, your choice on what the code should be, because it's such a great yardstick so that you're no longer having to worry about how many questions you ask in the history or how many bullet points you cover on your physical exam. That frees you up to be the ethical doctor that you want to be. So we're going to review the coding basics, we're going to write it in your language, and we're going to try to make it in a somewhat of an entertaining format for you to do so. Okay, so we'll jump right in. And this little teaching module was originally set up as a Jeopardy style teaching game, but we'll just go through these points just to make it a little easier for you to learn like this today. So we'll start off with risk for 10. So here's our first scenario. You have a patient on prescription medication, and if you review the patient's medication and you include it in your documented risk, what is the level of risk? So the level of risk is moderate. Now, if you have your little worksheet in front of you, this is what that little worksheet looks like. And so just look down on the little worksheet where it says moderate, and you'll see RX medications. So that prescription medicine is there, just, you can circle it if you want to, if you have it in front of you, but that just helps you remember that risk is really easy if your patient is on prescription medicine because it's an automatic moderate risk. And just think about how many patients you have that are on prescription medications. Now, the question usually comes up, do you have to be the one to prescribe the prescription medication? Suppose you're covering for your partner who's always on vacation. It doesn't matter. If the patient's seeing you in the office and the patient is on prescription medication, you're reviewing that prescription medication. And at that time, when you see the patient, the service is rendered, that prescription medication is under your supervision. So you get credit for it, whether you prescribed it or not. So the first example here, the risk is really, really easy. So let's go back to this section, risk of 10. And again, in our risk category, risk would be moderate. The management of prescription medications, whether it's outpatient or inpatient, carries a moderate risk. So just get in the habit of thinking that prescription medication is moderate risk, and this one's really, really easy. So we'll go on. Risk for 20. A patient comes in with a history of chronic diabetes and chronic hypertension. What is the level of risk? Well, again, this is an example of moderate risk. So let's take a minute and look at your worksheet. So look where it says risk, look at moderate, 2 or more stable chronic illnesses. Again, think how many patients you see who have 2 or more stable chronic illnesses. It's almost like chronic care 101 for primary doctors. Everybody seems to be on prescription medicines, and everybody seems to have 2 or more stable chronic illnesses. So again, another super easy rule for you to follow. So let's look at risk for 20 again. A history of chronic diabetes and chronic hypertension. What is the level of risk? And again, the level of risk is moderate. 2 or more stable chronic illnesses under your review today is moderate risk. Let's look at risk for 30. You have a patient who comes in with a mild exacerbation of asthma, and you intend to treat this patient as an outpatient. What is the level of risk? Again, moderate risk. So to illustrate this, let's look at your little worksheet. So if it's in front of you, just look under moderate where it says 1 chronic illness with a mild exacerbation, progression, or side effects of treatment. And I put these 3 examples at the very front. Why? Because it is telling you, it is illustrating for you, it is showing you how many patients that you take care of that have prescription medication, or there are 2 or more problems that you're looking at, or even if it's one of these problems with a mild exacerbation. All of these things equal moderate level risk. And so many doctors, they don't know this, or they're not comfortable with knowing this or haven't learned it. And that's one of the big reasons why doctors just don't know what to do. So, ethically speaking, if you're taking care of someone with a mild exacerbation of asthma, or it could be a mild exacerbation of CHF or gout, it doesn't matter. It's all moderate risk. Now, somebody may say, well, you know what? Congestive heart failure sounds worse than an exacerbation of asthma because the heart's more important, obviously, than the lungs. And then maybe the pulmonologist will say, well, no way, the lungs are more important than the heart. A mild exacerbation of asthma definitely is moderate, but maybe not CHF, because the radiologist always reads CHF, sometimes on x-rays. And then the dermatologist says, well, you know what? The skin is the most valuable organ. Exacerbation of eczema, that should be moderate risk. You can see where this goes round and round. And the answer is, it's all moderate risk, because these rules don't try to distinguish which is more severe or which is more important than the other. To a dermatologist, the skin is the most important. So you may think CHF is worse than asthma, but in the world of coders, it doesn't matter. A chronic illness with a mild exacerbation is moderate risk. Okay, so we're going to go back to risk for 40. A patient now comes in with a severe exacerbation of CHF. The patient needs hospitalization, and you feel that it is life-threatening. And there may be a risk for morbidity or mortality. What is the level of risk here? In this example, risk is now high. So now, this always brings up more questions. And I think it's a good place to put this question, because we were just talking about mild risk, or moderate risk, meaning a mild exacerbation of a chronic illness. So what does high risk really mean? We just got through looking at moderate risk. What does high risk mean? Well, high risk means it's high risk basically if you say it's high risk. So you as the doctor, if you document that the patient has worrisome conditions and may or may not be stable, and you're worried, then the risk is high. So it's the power of your documentation as to how bad it is right now. So being admitted to the hospital doesn't automatically mean high risk. It is what you document about the patient that means high risk. And I want to tell you guys a little story right now to illustrate risk, because this always confuses things. And let me tell you why. Let's go back and look at the worksheet. High risk talks about chronic illness with a severe exacerbation. Okay, but it doesn't really give you, it gives you a few examples like a seizure or a TIA, but it doesn't really go into all the multiple possibilities for what high risk is. And remember, these things over here are just examples that the AMA put out to help people understand what to do. So these are not my examples. And as we've said before, this whole coding worksheet has come across, these are from the world of the coders. These are what they look at the charts for. These are the bullets on exam, the bullets on the history, and these are the examples given to the coders to understand what high, moderate, low, minimal risk is. So we've got to put this in a way that you as the doctors can understand this too. So let's talk about this severe exacerbation for just a minute. Try to make sense of it. So to try to bring a little clarity to what high risk is, let me tell you a little story, and I always tell this story about little Jimmy. Little Jimmy gets a bug bite, okay? So little Jimmy gets a bug bite, and his mom brings you to you're in the doctor in the office, and little Jimmy's bug bite, oh, it's not too bad. And let's go back and look at our worksheet for just a minute. So when you see little Jimmy and you tell mother it's not that bad, go ahead and just keep it clean with soap and water. Don't worry about it. It should be fine. So think of that as minimum risk. It's like home remedies. It's rest, gargles, elastic bandages, superficial dressings. Those are the examples that the AMA has given down here in this section. But otherwise, you could think of it as soap and water, things like that. Keep it clean. And one of the coders, Denise Blackburn, told me this a long time ago when we were first making this, around 2002. She says, this is another way, an easy way to understand risk. And it has served me all these years, not only in my practice, but teaching other doctors about this. So, these home remedy type things help you understand what minimum risk is. So, again, you don't see bug bite down here in the minimum risk section at all. But you can make sense of the risk based on the treatment that you're rendering. Okay? Now, little Jimmy still has his bug bite because a couple of days later, little Jimmy's mother brings him in back to see you in the office, and little Jimmy's not feeling well. He's itching more. And it looks like there might be some pain there. And so you say, you know what, the bug bite's just a little bit more progressed. I want you to take maybe some Tylenol and some Benadryl. Okay? Over-the-counter medicines, over-the-counter Tylenol, over-the-counter Benadryl. That's all you need to do for little Jimmy. It's the same bug bite. Number one. Number two, you don't even see bug bite listed here. But it's the same bug bite. But now the treatment has advanced a little bit more so that you are now treating that bug bite with over-the-counter medications. This is an example of low risk. This low risk now is determined not because you find bug bite over here in this category, but that the level of treatment now that you have to give the bug bite has now advanced. And that's why it's low risk, okay? So now we take our example of little Jimmy's bug bite one more step. Mother comes back in to see you a few days later, maybe a week later, whatever. Now little Jimmy's bug bite is red. It's swollen. It's tender. It's warm to touch. And it looks like there's a red streak going up little Jimmy's arm. Oh no. And now you say, you know what? Little Jimmy's bug bite is now looking infected. There may be some cellulitis going on. And so now what you do is you put little Jimmy on an antibiotic. So now little Jimmy is on a prescription medication. Again, we don't see little Jimmy's bug bite over here, but what we do see is the treatment, the severity of treatment for little Jimmy's bug bite. And now, the same bug bite that was minimum risk, then low risk, has now become moderate risk. A few days later, even on the antibiotics, little Jimmy comes back with mother. Now little Jimmy is a little bit more lethargic. He has a fever. He's tachycardic and a little bit tachypnic. And you say, I'm worried about you, little Jimmy. And I'm worried enough I'm going to put you in the hospital, but I'm worried because you may be septic. And because you've documented in your note that you're worried about little Jimmy being septic, and that you're worried about either progression of this to morbidity, some type of morbidity, or risk to his well-being, it now becomes high risk. Why? Because you say it is high risk. And now you're treating with antibiotics, but you're putting him in the hospital. But the physical state of being in the hospital does not mean the risk. Because we have people in the hospital all the time that are doing much better. It's high risk because you say it is in your note. And you say septic or, risk for morbidity. And when that is in your note like that, now little Jimmy's bug bite becomes high risk. If the next day in the hospital, little Jimmy's bug bite gets better, he's still on antibiotics, but he's not septic or pre-septic anymore. Now, he's not high risk anymore when you're rounding on him in the hospital. And let's say you get ready to discharge little Jimmy back home on oral antibiotics. Now he's back on prescription medications. Same bug bite, moderate risk. A few days later, he's finished his antibiotics and maybe he's just taking a little bit of Tylenol as needed. Bug bite again, becomes low risk. A few days later, if he sees you in the office, you just tell him, don't worry about it, or just keep it clean. Soap and water is needed. That particular problem has come back to minimum risk. So again, it's not the disease sometimes, it's the level of treatment. And again, what we're trying to do is not turn you into a coder here. We're trying to put this in words that you can understand and relate to and use it in your practice with more confidence. So let's look at the last example of risk. Patient comes in with a breast lump. What is the level of risk? Let's look at our worksheet for just a minute before we advance. So when someone comes in with a new problem with uncertain prognosis, that is automatic moderate risk. Now, the AMA guideline here is breast lump. That's just an example. So, what are all the other thoughts? Well, anything that you put in your note, like a problem with uncertain etiology, uncertain prognosis. You could use the word uncertain prognosis. You could use the word uncertain etiology. Because many times people will come in to see you in the doctor's office and you don't have the answer. And if it's a new problem and the prognosis is uncertain, and you put it in your note, again, another example of moderate risk. So here we go. The patient complains of a breast lump. What is the level of risk? Moderate risk. So things that the AMA has given examples of that you'll see on your sheet is cardiovascular stress tests, treadmill, echo. Those are usually, these are just, again, examples. And sometimes they would be used for uncertain prognosis because you're not sure how the heart is doing. Referrals for elective surgery or a biopsy or an EGD. Again, you're not sure what the prognosis is. Again, sometimes these examples create a little bit more confusion because people always have sub-questions about this. But to keep it real simple, it's easy to remember any new problems that come to you with certainly uncertain prognosis are automatically moderate level risk. So in this section, we have tried to review some easy components of risk. We'll stop here and go on to our next section of data next time, and we'll review those components of complexity of medical decision making.